Okay, so they then also talk about central neurocytoma. Central neurocytoma, let's look at the images. We are talking about a central nervous system lesion or mass that is considered WHO grade 2. As you can see, it's usually in the ventricles, and if you look closely, you will see that it is attached to the septum pellucidum, and it is a little bit heterogeneous lesion on T1, as you can see right over here. It's considered again grade 2 neuronal tumor. Usually the age of these patients is young adults. The location, as you can see, is usually the anterior part of the lateral ventricle near the foramen of Monro. I mean the foramen that connects the lateral ventricles to the third ventricle. And sometimes it even extends throughout the foramen of Monro to the third ventricle. And as you can see, it may be in the septum pellucidum. It's heterogeneous, as you can see in this T1 imaging. It's multicystic. We will see this in T2, so maybe I'll have some T2 here. You can see those hyperintense lesions inside it. Those are the multicystic that cyst on it. Sometimes it's called Swiss cheese appearing. It's lobulated. As you can see, there are lobulations right over here or on this lesion. And when you give some enhancement, I mean, when you give contrast, you will see a moderately enhanced lesion attached to the septum pellucidum. And you also may see some classifications. So let's see. So this is a T2 image, and you can see those cysts inside it. Those are the hyperintense T2, and you can see that it's quite lobulated. So this is the central neurocytoma. You can see lateral ventricle attached to the septum pellucidum. It can, of course, as a lesion in the ventricles, it can cause, as you can see, a hydrocephalus because it can just obstruct the CSF flow. So this is the central neurocytoma. Thank you very much. Thanks for, of course, there is a differential diagnosis, but thanks for Radiopedia. About the treatment, surgical resection, and if you can't take it all out, you can add some radiotherapy. Anyway, this is about central neurocytoma. Thank you for Radiopedia, and thank you all, and that's it.